we need to train physicians to think deeper. What are some of the major symptoms of fat digestion problem or any digestion problem? One of the things people don't realize is when we're looking at anatomy wise, what are all the pieces of the gut that's involved from the mouth all the way down to the stomach here. And right here, the esophagus is what connects your throat and your stomach, right? And then from your stomach, it goes into the small intestine. But before it goes to small intestine, right here in this area is a really important area where the liver's there. This green little area here is your gallbladder. And I just want to explain that it is there for a reason. Answer in chat right now. What is the major function of the gallbladder? Digestion, fat digestion, right? And then if you look over here, the pancreas is also there, right there. That's the little leaf looking thing. And that one also secretes into the small intestine to help with digestion. Okay. And then down through the small intestine and then all the way back to the large intestines and then out through your stool. This is the whole digestive system that we're talking about. And there are many steps that are involved. Let's think about what are the underlying reasons. And this is a conversation. Of all the people who've had gallbladder removals, do you know why you needed the gallbladder removed in the first place? What is the underlying problem that caused you to need a gallbladder removal in the first place? Type in chat. I'm all about root cause. You got to understand why. Like, what's wrong? What's the problem? Gallstones. Okay. Someone says gallstones.
Someone else said inflammation.
Okay.
Another vote for stones.
Someone had polyps in there. Someone says inflammation in there. Okay. What do you think causes gallstones? What do you think causes polyps in a gallbladder? Anyone know? Someone thinks hormones. Someone thinks cholesterol, animal fat, eating too much fat. Someone thinks bacteria. Backup fluid. Interesting. Okay. Kind of right. All right. So one of the underlying problems is that when food goes through from your stomach into your small intestine, then there are hormone signals to your gallbladder that says, oh, there's fat in there. And your gallbladder will squeeze its contents out into the small intestine digestion. But what happens if any part of that process where the liver makes these bile salts, it goes in the gallbladder. And if the gallbladder, let's say, doesn't squeeze very well, there's a hormonal misconnection between the bowel sensing the food and your contraction of the gallbladder. Let's say it's a weak contractor. Then what happens? It's stagnant. It sits there. And then it causes what? Gallstones. So you can see that it is actually a piece of broken fat digestion anywhere in the steps of that process. It just takes one little step broken in all those steps with fat digestion for what? Gallstones to occur. So broken fat digestion is the reason why you have gallstones. Why do some people need surgery? Well, those gallstones, what happens is that when it squeezes, it can actually sometimes block the little tube that's supposed to come out, like the neck of a balloon. And when it blocks that area, then that's why people are answering. Some of you guys talked about backed up fluid. Some of you talked about bacteria. You're right, but it's a result of the gallstone getting stuck. Okay. And so that's the problem, right? And then when it starts to get stuck or it's like little pieces passing, it causes pain. And then you go to the doctor and they say, oh, it's the gallstone. That's the problem. Let's remove the gallbladder. Okay. I'm going to ask you something about the scenario. Okay. Once you remove the gallbladder, if you needed surgery, my question for you is, what happens to fat digestion? What do you think happens to the underlying problem of fat digestion in the first place? When you remove a gallbladder, does that fix your fat digestion? Hint, hint. Hi, I'm Maggie Yu, MD, and I'm a functional and holistic medicine physician and the creator of the Transform and Transform protocol. If you're interested in learning what are the root causes of all chronic disease, go ahead and click the link in the description where I have a power-packed 30-minute training that goes over what are the 5 pillars of Transform. Go ahead, click the link, and I'll see you in that training. This is the thing that doesn't make sense to me, but it's the idea that if you go to a surgeon, you're going to get a surgery. That's their only job, is to tell you whether you need a surgery or not. They don't care. They don't understand. They know nothing about your fat digestion, right? And to me, actually, someone wrote this is super smart. They said that it actually made them worse. So what happens is you remove the gallbladder, you no longer have the pain from the stones, but now your fat digestion is what? Even worse. Even worse. So then what kind of problems occur when you have almost no fat digestion? Do you guys know? Does anyone know? And some of the alumni might jump in. What would happen to you if you don't digest fat at all? And someone said toilet run. Fern already. Fern's coming in with some strong answers. I haven't met you, Fern, but you got some good answers going on. What happens, right? If you don't digest fat at all, if you don't digest it, you ain't going to absorb it. So what's going to happen, right? They'll have stomach pain. They may even have diarrhea, right? When there's a lot of undigested fat in your stool, guess what? It floats. How many of you guys have floaty stools, right? That's a sign. Lisette says dumping syndrome, right? A lot of problems, right? And then the other thing is that when you don't digest the fat, you're not absorbing it into your body. Do you know what those healthy fat molecules really do? Someone mentioned hormones a lot earlier. They were right. So here's the thing. Your hormones, you can't make hormones unless you have these healthy fats, healthy fatty acids that come in. The basis of the hormone molecules are actually these essential fatty acids, omega-3 fatty acids, that you can't absorb if you've had your gallbladder removed and now you have almost next to no fat digestion. So I'm going to ask everybody who's had a gallbladder removal, and this is just an example, like anybody else who had bowel surgery, also type in here. What kind of problems, health problems developed after you had the bowel surgery, right? At the time, we as the surgeons congratulate ourselves and say, we got rid of the gallstones, the cause of the gallstones, and you're good, you're gone, right? You go to a surgeon, you're going to get surgery. But what happened after that? I want to know what are some of the downstream effects that happen, right?
Well, Dawn's saying high cholesterol. Elaine, IBS, irritable bowel syndrome, poor digestion, low hormones and weight gain,
ulcerative colitis,
the development of Crohn's and ulcerative colitis,
autoimmune diseases. Can removal of a gallbladder, this is a good question. How many people here have an autoimmune disease that was triggered post-surgically? There's a huge link, by the way, between the trauma of any surgery will trigger huge hormonal shifts, huge blood sugar shifts, huge shifts in the bacteria in your gut. And those three are the biggest triggers of autoimmune disease. So I'm just giving you an example where we need to train physicians to think deeper. What are some of the major symptoms of fat digestion problem or any digestion problem? Not just the gallbladder fat digestion problem, but let's list some of these symptoms so you become aware and the light bulb comes on as to, oh my gosh, a digestion problem could be an underlying root cause of some of my health problems. Like, look at this, right? Bloating, gas, heartburn, acid reflux. Somebody even mentioned mast cell. Who's that super smarty pants? Constipation, Olivia. All of the above, Dawn is saying, right? So I'm here to tell you that one of the things that I spend a lot of time in all our programs to really talk about and teach is just how big of a problem underlying digestive breakdowns are. And I'm going to tell you, just as something valuable for you guys is to think through, is that underlying causes of a lot of these surgical problems. Those of you who've had heartburn surgeries, do you guys know that the major reason that people have esophageal dilation, stomach type of surgeries, is because stomach acid problem, and it's low stomach acid in their stomach. So some of the steps in digestion, here's an overview, is mastication means chewing the food. So if you take every bite and you chew it 10 times, it makes a big difference. If you drink a sip or two of water, that also aids in digestion with each bite. And then think about stomach digestion, acidification. So really acid. I think it's an epidemic of low stomach acid to most of your health problems. And if there's somebody in the audience where everything I'm talking about is resonating with you and you're starting to make the connection that you may have a big digestion problem and you think it may be linked to some of your symptoms, type it in chat. Hi, and thank you for watching this video. If you're interested in actively looking for a solution to your problem and you'd like to work with us, I'm going to invite you to go ahead and click the link in the description to book a chat with our team. I and my team look forward to talking to you to learn more about you, to see if we are indeed a good fit to work together. Thank you.